Can a patient request discharge from the doctor treating him, or is it going to be the prerogative of the treating physician? When a patient insists on discharge, what does the hospital do? Does it give a regular discharge, or it's given discharge against medical advice, DAMA? All these interesting questions have been answered by a recent judgment from the National Commission. In this case, the patient, a known diabetic with chronic kidney disease, is admitted under a nephrologist who happens to be his friend. The patient is diagnosed with Budd-Chiari syndrome. The patient is stabilized and discharged after 7 days. 15 days later, the patient is brought in a serious condition with high creatinine levels. The nephrologist, after admitting, has to go for a pre-scheduled conference. The patient is advised hemodialysis. The patient's relative insists on a discharge, saying they want to take the patient to another facility in another city for better management. The resident on duty fills in a discharge summary, specifically mentioning the fact that this is a discharge on request. The patient is taken to the airport. Coincidentally, the nephrologist happens to be in the airport, who, on examining the patient, advises the patient to go back to the hospital as his condition is not okay. On the way back to the hospital, the patient dies. The relatives of the patient file a case of negligence against the hospital and the nephrologist. On perusal of the records, the nephrologist is held not liable by the court. The court, in fact, appreciated the nephrologist for walking that extra mile in the interest of saving the patient's life. But the court drew adverse inference to the fact that the patient was given discharge on request. The court said that the patient's relatives had not given any written undertaking to the hospital and it was not there in the medical record. Furthermore, the court said when the patient's relatives have been informed of the consequences of the discharge, their patient should have been given discharge against medical advice, DAMA. Friends, in the field of medicine, there are two types of discharge. One, when the patient gets cured or the treating physician decides that the patient is fit enough to be discharged. Two, if the patient's relative insists on a discharge despite being told the consequences of the discharge, including the consequence of death, then the patient should be given discharge against medical advice, DAMA. There is no concept of discharge on request in the field of medicine. Thank you.